Hello and welcome. Today we're diving into a common, yet often misunderstood, condition affecting men: prostatitis. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. Prostatitis, simply put, is inflammation of the prostate gland. But what causes this inflammation? In many cases, bacterial infection is the culprit. These infections can arise from bacteria traveling up the urethra from the bladder, or even through the bloodstream. However, not all prostatitis is bacterial. Sometimes it's caused by nerve damage in the pelvic area, chemical irritation, or even a weakened immune system. In many instances, the exact cause remains unknown. These cases are categorized as non-bacterial prostatitis. Now let's talk about the underlying mechanisms of prostatitis. In bacterial prostatitis, the bacteria invade the prostate gland, triggering an immune response. This response involves the release of inflammatory chemicals, leading to swelling, pain, and potential impairment of prostate function. In non-bacterial prostatitis, the pathophysiology is less clear. It's believed that nerve irritation, muscle spasms in the pelvic floor, or inflammation from unidentified sources can all contribute to the symptoms. Prostatitis is a fairly common condition, affecting men of all ages, although it's most prevalent in those under 50. It's estimated that up to 10% of men will experience symptoms consistent with prostatitis at some point in their lives. While acute bacterial prostatitis is relatively rare, chronic prostatitis, both bacterial and non-bacterial, is much more prevalent. The signs and symptoms of prostatitis can vary depending on the type. Acute bacterial prostatitis is usually present with sudden and severe symptoms, including fever, chills, body aches, pelvic pain, and pain when urinating. Men might also experience frequent urination, urgency, and difficulty emptying the bladder. Chronic prostatitis often has more subtle symptoms. These may include persistent pelvic pain, discomfort in the perineum, the area between the scrotum and anus, painful ejaculation, and urinary problems such as weak stream or dribbling. Some men with prostatitis, particularly asymptomatic inflammatory prostatitis, may not experience any noticeable symptoms at all. This type is often discovered during tests for other conditions. Diagnosing prostatitis involves a combination of medical history, physical examination, and laboratory tests. A doctor will typically perform a digital rectal exam, where they gently insert a gloved and lubricated finger into the rectum to feel the prostate gland. Urine samples are collected to check for bacteria and white blood cells indicating infection. In some cases, a SIM analysis may be performed to assess for bacteria or inflammation. Additionally, blood tests can help rule out other conditions and evaluate prostate-specific antigen at PSA levels. Although an elevated PSA can be caused by prostatitis and doesn't necessarily indicate prostate cancer. Prostatitis is often classified into a few main types: acute bacterial prostatitis, chronic bacterial prostatitis, chronic non-bacterial prostatitis, also called chronic pelvic pain syndrome or CPPSC, and asymptomatic inflammatory prostatitis. Acute bacterial prostatitis is caused by a sudden bacterial infection and is characterized by severe symptoms. Chronic bacterial prostatitis is a recurring infection that can be difficult to treat. Chronic non-bacterial prostatitis, or CPPS, is the most common type and is characterized by chronic pelvic pain without evidence of bacterial infection. Asymptomatic inflammatory prostatitis involves inflammation of the prostate without any noticeable symptoms. Treatment for prostatitis depends on the type and cause. Acute bacterial prostatitis is typically treated with antibiotics, often for several weeks. Pain relievers and alpha blockers, which relax the muscles in the prostate and bladder neck, may also be prescribed to help with urinary symptoms. Chronic bacterial prostatitis often requires longer courses of antibiotics. Chronic non-bacterial prostatitis, or CPPS, can be more challenging to treat. Management strategies often involve a combination of approaches, including pain relievers, alpha blockers, pelvic floor physical therapy, biofeedback, and lifestyle modifications. Alternative therapies, such as acupuncture and herbal remedies, may also provide some relief for some individuals. Asymptomatic inflammatory prostatitis usually requires no treatment unless symptoms develop. Preventing prostatitis can be difficult, especially in non-bacterial cases. However, certain measures can help reduce the risk of bacterial prostatitis. These include practicing good hygiene, especially after bowel movements, and avoiding activities that may irritate the urethra, such as prolonged sitting or bicycle riding. Staying hydrated and emptying the bladder regularly can also help prevent urinary tract infections that can lead to prostatitis. If you are prone to urinary tract infections, talk to your doctor about preventative measures. The prognosis for prostatitis varies depending on the type and severity. Acute bacterial prostatitis usually responds well to antibiotics, with most men experiencing a full recovery. Chronic bacterial prostatitis can be more challenging to treat and may require long-term management. Chronic non-bacterial prostatitis, or CPPS, can be a chronic condition, but symptoms can often be managed with a combination of therapies. Recent research is focusing on understanding underlying causes of CPPS and developing more targeted treatments. This includes exploring the role of inflammation, nerve sensitization, and psychological factors in the condition. Advances in diagnostic techniques are also helping to better identify and classify different subtypes of prostatitis, leading to more personalized treatment approaches. Thank you for watching, and we hope this has provided you with a clearer understanding of prostatitis.